Hello, I'm Dr. Anamika Joshi. I'm an oculoplasty specialist, which means I'm an eye plastic surgeon. I practice in Hyderabad in India, and today I'm going to talk about eye bags. So, eye bags or puffiness under the eyes can really make you look tired. And one of the common lines that my patients tell me who have eye bags is, I'm tired of looking tired. So, research says that when somebody looks at you, the first area that they unconsciously notice is eyes. And eye bags can make the eyes look really tired. As a result, you may look very dull even if you are not. So, let us understand why do eye bags happen and what are the remedies and treatment for it. Now, under eye bags could be either because of a fluid component or a fluid retention, or it could be because of fat component. Eye bags which are variable and they just appear at times, these are mainly because of fluid, but eye bags which are there permanently, whether you sleep well, you don't sleep well, and they're there all the time, then it's most likely because of fat bags. So let's understand the differences. Fluid bags like sudden increase in the bags and then it becomes normal could be because of temporary fluid retention. That can happen if you don't sleep well. When you don't sleep well, your body tends to accumulate more fluid. Your blood vessels under the eye tend to dilate. If you have any allergies, that also can cause fluid retention near the eyes. Apart from that, smoking can cause reduced quantity of collagen under the eye area and can worsen the bags. Now, what are the solutions for these temporary eye bags? One thing that works well is cold compresses. Now, cold compresses, they constrict the blood vessels around the eye and therefore help in aggression of this fluid, and temporary it kind of reduces the fat bags. So you could use ice packs, or you could use refrigerated tea bags, you could use cucumber, a cold spoon, whatever. It mainly works through cold compresses. Using tea bags and other things can also provide some antioxidants, and therefore people prefer that. That can improve the quality of the skin. There's no scientific evidence, but that may help. So cold compresses is one thing that can help. Second is you can sleep well, as I said, because a proper sleep makes sure that you don't retain a lot of water. Third is a low sodium diet. So if you take a high sodium diet, then again you'll have water retention. So always stick to low sodium diet, but hydrate yourself well. So keep yourself hydrated, but take low sodium. Next is avoid rubbing, because rubbing can actually increase your eye bags. So wrong techniques of face yoga, too much rubbing on under eye area can weaken your septum, can weaken your muscle there, and can actually increase the fat prolapse. So avoid rubbing your eyes. Apart from that, avoid smoking if you indulge in smoking, because that can reduce the collagen production and can cause more aging changes under the eye. So these are some home remedies. Now, home remedies work temporarily and they work only on the fluid component. If you feel that your eye bags are there throughout the day and they don't go even if you sleep well or if you follow a good diet, then it's mainly because of anatomical fat bags. Now let's try to understand this. So normally our eyeball is protected by a normal cushion of fat, which is important. Now what happens is slowly with age or because of genetic reasons, the septum that keeps the fat behind loosens with time, as a result of which this fat tends to prolapse out and you can see them in the form of eye bags. How do you know that you have fat eye bags, meaning eye bags due to fat prolapse? Try this at home. You could try and look up, and when you look up you would see that the fat is bulging more, because when you look up the eyeball moves behind and kind of pushes the fat bags forward. Now when you look down, the eye bags can appear less because now the eyeball is kind of rotating anteriorly and therefore the eye bags appear less. So if your eye bags are increasing while looking up and decreasing while looking down, it's most likely because of fat bags like fat prolapse. So fat prolapse doesn't get treated by the home remedies, and it requires a more definitive solution, that is a surgery. Now, surgery for eye bags is called lower eyelid blepharoplasty. So, traditionally, lower eyelid blepharoplasty earlier used to be done by an incision onto your lower eyelid and the fat was extracted out. Now, our techniques have improved, and I, being an eye plastic surgeon, I'm very well trained in the area of eye. So, I always prefer scarless techniques in which I make a hidden incision onto the inner side of the eye. So once we make an incision there, it becomes completely scarless. It reduces the chances of any major complications. And from that incision, we can either remove the fat or we can transpose it down, giving rise to a nice plain contour and making the eye bags almost completely invisible. So if you have eye bags, you can first try home remedies at home, but if they don't work, then it's time that you meet a specialist to understand whether you have fat bags or is it due to something else and what is the correct treatment for it. To know more details about surgical techniques, I'll be sharing it in my next videos where you could understand even more details about eye bags. Thank you, hope it helps.